Greetings from Manipur. I would like to talk on about the sexual health for the public. Sexual health is defined a state of physical, mental, and social well-being in relation to sexuality. According to WHO, for sexual health, 3 criteria are put. That is, first is ability to enjoy and maintain a good sexual relationship in accordance with the personal and the social ethics prevailing in that part of the world. Number 2, the people must be free of fear, shame, and then the coercion and so on from others. They must enjoy the relationship with their partner. Number 3, they must be free from the diseases like endocrine disease, like diabetes, or if at all, it must be control, or thyroid, and infections in the genitalia. If these things are prevail, suppose there is a fungal infection in the external genitalia of the male or female, or some other, they will not enjoy the sex. So that is about the sexual health, and this is being neglected by the people because the sex, when they hear, there's a stigma of obscenity. That's why people don't talk. So I would like to tell the people that there are a lot of myths in the sexual health, thinking that once a woman attains a menopause, their sex life is over, and a male, once he reaches around 60, he thinks that his sexual life is over. It is not. Sex has no expiry date. They can enjoy sex till they die. So, for that, they must know the physiology. The sexual drive has the response has got few stages. The first is called the desire or the libido. So that may be reduced as the age advances. But then when you discuss with a doctor that the testosterone level, how is the testosterone? If the testosterone level is low, it will go down. So your doctor may give the supplement of testosterone after ruling out a disease in the male, what is called a carcinoma of the prostate. Then that excitation, there is after this year, once stimulated, there is a phase of excitation. Penis get engorged, enlarged, and it become erect. The female genitalia become swollen, and the vagina get lubricated. So when this is not there in the male, particularly PDE5 inhibitor, the drug has to be utilized, and that will excite, that will make the penis erect, and so we might have to know, the individual must know that what is their problem, and they must consult the doctor who practice this type of medicine, that is sexual medicine. Going to any doctor won't serve, because this training is imparted only in few doctors and those who are interested in this area of the medical science. That is one. Then the top of the response is the climax. In the layman term, it is called climax, or it is called orgasm, where there is a release of the accumulated neuromuscular tension, both in the male and the female, and there is after that there is a resolution, there is a relaxation. The male will not be able to perform sex for about few hours or even 1 hour or so. In the female, it usually doesn't. So in the case of the female, when there is menopause, the vagina may get dry. For that, your doctor may replace hormone like estrogen and so on, which may be given orally or as a cream. So, and then if there is an infection into the external genitalia, for that we have medicine like antifungal drugs, this and that. And suppose if the individual is suffering from the low thyroid, again the epitheliums are dried. There also, once you replace thyroid hormone, that can be solved very easily. And diseases like diabetes, there are a lot of drugs And for the erectile dysfunction, from extreme, that is from medicine, to the extreme, putting a prosthesis can correct all these problems. So don't suffer silently. Come forward. Nothing to hide. Nothing to feel ashamed of this. Please come forward, and we'll take care of you. Thank you very much.